Taylor Begley here in studio with Dr. Paul Fadale from University Orthopedics, because we've got big injury news in the world of the Patriots this week. Two key defensive players, the guys that you did not want to see them lose, they go down reportedly for the entire season. Let's start with Matthew Judon tearing his bicep. Can you give the layperson that's listening to this kind of a rundown of what this injury is?
It's pretty unusual in the NFL, actually, and it's an injury at the elbow. There's two biceps, one in the shoulder, one in the elbow, and that's the tendon on the muscle that pulls your arm up. And you can see him when he's tackling, his arm is being snapped back. The tendon just pops right off the bone. So that's something that has to be fixed. There's no negotiating in it, and he's either had the surgery or will have it very soon. That has to then heal. We have some really strong material to put that together, but we're going to talk about how long till he comes back.
Yeah, so reports where he got the surgery on Wednesday. For that type of injury and that type of surgery, typically what's the recovery timeline?
Well, we don't want typically, because typically, if you look back in the literature, it's upwards of 40 weeks or more. We do not want typically. Some people have done it in short as 2 to 3 months.
Wow.
And so I think he is going to try to come back before the end of the season. Unlike shoulders that we may talk about, elbows are pretty easy to brace, and therefore it is actually technically possible, if he can get through that recovery, to brace that elbow so that the repair actually takes very little pressure on it, and theoretically he could go back and play.
So when you said 2 to 3 months, is that for athletes or for anybody recovering from this kind of surgery?
So we go back to the science and dig up the world's literature. How do athletes do? And it's not a common injury in the NFL. It really is not. Those athletes really were out for several months. But our newer techniques, they're much, much stronger. We can heal athletes much faster now. So I think it's possible, depending on other options, how well the team is doing, et cetera, that he may try to come back.
Yeah, that's a big factor as well, not wanting to come back if the team is not doing well at the point that he would be able to return with this particular injury. But I want to talk a little bit more about that particular injury and his position. Is that a factor in terms of if he was a different position, if it was a quarterback and it was his throwing arm versus a linebacker for that type of injury with the bicep, is that something that, because of his position, allows him to potentially come back sooner?
I thought actually the other way, and you are correct. Position injuries make all the difference in the world, but where he plays, he's trying to wrap people up and slow people, and he's got his arms out there. That's where the brace is going to have to do all the work, and he can't really fully extend and do the things he does. So he'll be a little bit compromised. You know, linemen who damage their hands, they put a mitt on, and they can play, no difference in how they play. For him, it'll affect him a little bit.
Yeah, and you mentioned that with him coming back, it depends on how they're doing. If you're his doctor and the team is not doing well, if the team, by the time he can come back, is either out of the playoffs or way down in the standings, do you recommend for somebody like that to rush their way back versus if the team was in a playoff race?
Well, the physician's not supposed to get into those discussions, but he's 31 years old. And so we're getting up there in years. And when athletes are at that part in their career, they have to decide, is it worth the risk? If we're going to the Super Bowl, this team is blessed, we're moving forward, I may never get here again. And we start doing things and choices at the end of a season, heading into playoffs, that we would never make normally, because this is it. This may be your last chance. Now, another role. The team's not doing so well. You say to yourself, why cut your career short? We're not going to go to the Super Bowl. Maybe we could let this heal more, and that would be okay too. So when we ask, is an athlete coming back? There's the injury, there's the surgery, there's the protecting it, and there's the contract. There's a lot of things that go into deciding it. A lot of factors.
Okay, before we get into Christian Gonzalez, I want to bring up something that you mentioned with Matthew Judon, the timeline being shorter. We also talked about this off air beforehand about Aaron Rodgers talking about making a comeback later in the season. Is this just the way medicine is moving, the way that doctors are able to repair these types of injuries, that players are able to come back so much quicker?
Absolutely. Again, we always go back to the science, but we're looking at science from people way in the past. Current techniques where we augment our repairs really let the athletes cheat. So we did talk about Aaron Rodgers. We can put tissue in there and sutures in there of high strength that we don't have to wait until the tissue's 100%. For Judon, it's the same thing. He doesn't need 100% when he goes back out, because they're going to put some braces in there to augment it. So yeah, we can get the athletes out there much faster. Now, whether that's good or bad, I don't know on the athlete himself, but absolutely, things have all changed. And that puts us in uncharted water because we can't go back and say, well, for the last 10 years, the average to come back is, because it doesn't make a difference 10 years ago. It makes a difference now.
Yeah, and that's what we're seeing. That's what we're hearing around the league. And again, Aaron Rodgers' situation is going to be similar to that of Judon. Where's the team at when he's looking to come back? Because obviously he's up there in age as well. All right, now somebody who is not up there in age at all, the rookie Christian Gonzalez, who just came off Defensive Rookie of the Month, goes down in the first quarter of this game, and it is a shoulder. It seems like a labrum tear, and it's because of a dislocation in the shoulder. Can you run through that injury?
So just briefly, there's a ball and there's a socket, and there's your shoulder. And around the socket is the labrum, and everything plugs into it. So when that shoulder comes out, everything gets ripped out. So if you have a shoulder dislocation, the labrum is torn. Now the game begins. Where is it torn? How much of it is torn? Was there a break in the bone on the glenoid or on the back of the humeral head? So just the dislocation, he could have gone back to play. And in the NFL, the average to go back to play is 4 to 6 weeks if you pop it in, rehab it, and go back. They decided to operate on him, and we can talk about all the options, but it must have been a bigger injury where they didn't feel comfortable treating him closed. So he's going to be out for the season. Right.
So what's the range of that type of injury? I know you mentioned that some are a lighter tear, it's not as big of a tear, some are more intense. So what's kind of the range of when you have a shoulder dislocation, the minimum versus the maximum of what this injury could be?
Well, first is he's 21 years old. I tried to find out if this was his first, second, or third. That's the most critical issue here, is what number, because once it's your second or third at that age, it's going to keep coming out. And secondly is how much is torn. There's the labrum part of it, and there's the bony part of it. And as this gets more complicated, the chances of treating it conservatively goes out the window. So there are a lot of athletes you cover, and they sublux their shoulder. Sometimes they come out and they pop them back in, and within a few weeks, they're back playing again at a high level in a harness. But if it's damaged badly enough, it wouldn't be fair to let a 21-year-old athlete go out and play again. So take the loss, fix him, reconstruct it, rehab him, and he'll be back for next year. You can't protect the shoulder like you can protect an elbow.
Right. That was going to be my next question, because especially at his position, needing so much mobility with his arms, there's nothing really you can do other than let the injury heal, right?
Right. So what they wear is harnesses, and what the harness does is it prevents your arm from going out here. If your shoulder's down, your arms are down, almost impossible to knock it out. What does he do for a living? He does that for a living, which means he cannot possibly protect himself. So again, why could this person be braced and that one not? It depends on the joint. Shoulder's too unstable, not easily braceable.
All right, Dr. Fadale, thank you so much for joining us here on 12 Sports.